Since mid-2013, Tennessee's Medicaid program, TennCare, has been leading a statewide initiative to transform the way healthcare is delivered and paid for across the state. The main medical initiatives have been around primary care transformation and specialized or acute episodes of care. These initiatives have several principles in common: changed incentives, more information, enhanced technology, increased accountability, and a focus on quality and cost effectiveness. All these principles can be summed up in one word: value. We are moving TennCare and the entire state to a model that improves the value of care provided for all Tennesseans.
If we can come together as payers, as administrators, as physicians, and identify these areas, our goal is very simple, but it is attainable, and that is to lower cost and improve quality.
The most important decision we have made is to get feedback from as many stakeholders as possible. Over the last 4 years, we have held over 1,000 meetings with groups including professional organizations, payers, the public, employers, other state and federal agencies, and providers. We primarily get input from providers of all types, including hospitals and physicians, through meetings we call Technical Advisory Groups, or TAGs. These are groups of practicing providers across the state who come together to give specific feedback. The interest and willingness of our providers from all regions, specialties, and practice types has been remarkable.
I think it just gave a primary care perspective. I've discussed these issues with my cohorts and brought their thoughts as well. Overall, I'm quite impressed. I thought that there was a lot of preparation done prior to the meetings, illustrating the data that on claims and quality, and reviewing guidelines, best practices.
The advanced work that your people have done in the background with reporting and pulling together data, it really shows, and it's really helped to expedite the process and keep it moving forward, to keep us kind of on track and just answering questions and moving forward. So I thought it was very streamlined from previous.
I do feel 100% that I have been allowed to voice my opinions and to voice my concerns, to see the positives and the negatives, and I've always felt that you and your staff have been very listening and approachable.
This feedback has helped us avoid many potential unintended consequences and perverse incentives. For each TAG group, we start with a patient journey for a particular episode. We discuss best practices that improve quality and cost efficiency. These best practices inform clinical recommendations for the episode, such as what starts an episode, how long the episode lasts, and how to measure quality.
Overall, I think that you had brought to light a lot of our concerns. And I think if we can remain advocates to keep the patients first, that's going to be the benefit. And I think you've done a great job with this, and I think overall the program's been a success.
It'll give us more opportunities, I think, to have an open discussion with the doctors that are involved and those that are interested, but I think we'll be able to interest other physicians to become part of the discussion, which affects them in their practice going forward in the future, as well as how they're going to interact with the patient-physician relationship, which I think is really the foundation of medical care. I really enjoyed the opportunity to have come down to here. This is voluntary for the docs. I did it through our Upper Cumberland Medical Society.
I think it's on the right track in terms of improving the quality and also trying to constrain the cost. I think it's going to be something that's going to illustrate to other states in our union that there's something to be said for improving care for patients while also containing the cost.
I don't have any real specific suggestions to make it better. I just would like to congratulate TennCare on just putting this forth.
I will have to say that I'm as proud as ever to be a volunteer in the state of Tennessee.
I appreciate your interest in TennCare's payment reform program. If you'd like to learn more, visit our payment reform website below. You can sign up for regular program updates by emailing payment.reform@tn.gov. Again, thank you.